Rheumatoid. Okay, this is an interaction of immune cells and fibroblasts, which are often found in connective tissue, particularly joints. The T cells, and particularly the T helper cell type 17. Okay, rank L is the receptor for nuclear factor kappa ligand. That is the NFKB, which if you've watched any of my other talks, the nuclear factor kappa beta is a transcription factor that turns on inflammation. So there's a receptor that turns it on. In rheumatoid arthritis, you have increased number of those receptors on the synovial fibroblasts. Synovial cells line joints. So this is why it's polyarticular or affects multiple joints. You eventually produce more of what are called metalloproteinases, which are ways to destroy the proteins of bone and cartilage, so you get bone destruction. The synovial lining is fully dysfunctional all the time. It gets very thick, and then bone formation gets disturbed. And so a lot of people with rheumatoid arthritis is untreated. If you take x-rays, their joints have holes in them, there's erosive cysts, it's just a big mess. Because of the bone destruction associated with the cytokines that are produced by the dysregulated T cell mediated system. Rheumatoid factor is an autoantibody that we look for when trying to diagnose this, but I'll be honest, rheumatoid factor is present in about 15% of the normal population. So this is why sometimes even when you have a rheumatoid factor, you go see a rheumatologist and they say, you don't have rheumatoid. I'm going to tell you why in a minute. They tell you that. And then, of course, you get resident memory in your CD8 cells. And if you recall, the CD8 cells are cytotoxic. So these are designed to recognize synovial lining fibroblasts and attack. So rheumatoid is a chronic disease whereby you're attacking your own joints and connective tissue. Remarkably unpleasant, obviously. Okay, this is why your doctor typically won't tell you you have rheumatoid, even if you think you do or another doctor thinks you do. You have to meet they basically created this is where AI is going to come in. If you don't meet this algorithm, you don't have RA, okay? So you have to have numbers 1 through 4, all of them, for 6 weeks or more. And then you must have 4 or more of them in general. This is the American College of Rheumatology criteria as of 1988, okay? I think the next slide gives us the updated one, the 2010 criteria. Let's go to the next slide because I'm just showing them the old criteria. Yeah, this is the newer rules so look at this. Look at this algorithm. This is why you don't get told you have RA. So you have to score greater than or equal to 6 points. You must have had at least one swollen joint, not better explained by something else. And yes, you have been reduced to a point system. So you could show up with your toes looking like that, but if you don't get the right number of points here, you're not going to be told that you have rheumatoid arthritis. It goes with symptom duration, how many joints are affected, what is your blood work showing, and then your inflammatory panel. So you have to add up a certain number of points in order to meet the criteria of having a rheumatoid, whether or not you have rheumatoid factor in your blood.